Well, the very first OneWorld Community Health Centers clinic opened in 1970. Several satellite clinics have opened since then.
A center dedicated to teens and young adults is coming soon, as in today, and OneWorld is already the largest provider of primary health care services in South Omaha.
Adolescent Outreach Coordinator Alyssa Watts is with us this morning. Good to see you again, Alyssa.
Back.
Yeah, thanks for stopping by.
Thanks for having
All right,
me.
you guys have been busy, right? Opening locations, other locations, other centers. What's the latest? Mary was talking about it.
Yeah, well, we just opened our Bellevue clinic, and up today is our Teen and Young Adult Health Center right there on 24th Street. So like you said, we're already pretty big in South Omaha, but now we want to specifically cater to that population of young people in South Omaha.
So starting today, this is the soft opening.
Yeah.
What does that mean to patients?
It means we'll see our first patient today. With any luck, we haven't gotten snowed in, and we've opened our doors already, and we'll be seeing folks today. So we'll have our grand opening on the 26th. We'll have a big ribbon cutting and a ceremony. We'll have an open house where everybody can come and check us out in the afternoon that day. But today, we hopefully will see our first patient at least.
It's wonderful.
Continuing to grow. And then you have the Teen and Young Adult Health Center that's going to open. When is that place opening?
That's it.
Oh, that's the center.
That's what she's talking about.
Oh, I thought it was just a
Bellevue?
separate clinic. Yeah,
No.
Bellevue.
That's what
Bellevue
she's saying.
already opened.
Oh, you're kidding me. Stop right there. So who should be seen at this clinic, the Teen and Young Adult Center?
So teen and young adult is 12 to 24. Hopefully we're seeing that transitionary phase from pediatrics to adults, transitioning young people from being in that pediatric setting to being able to advocate for their own health care.
I'm wondering about the services you offer then, because when you're 12, your needs are quite a bit different than if you're 24. So what do you have
so
for everybody?
We're offering a full range of medical services. We're offering everything from those 12 and 13-year-olds coming in for their school physicals and their sports physicals, and they have vaccines that they need. And that primary care, as they get a little bit older, they're going to need some more complicated things. Some of them are going to start wondering, having questions about sex, having questions about STDs and how to be safe and how to make decisions around their sexual health. So we're hoping to offer all of those services. Young adults really need to feel still comfortable. A lot of young adults stay with their pediatrician for a little while past becoming of age, because they're looking for a safe environment where they can kind of learn to be independent adults in healthcare, in a healthcare setting.
You are an outreach coordinator, right?
Yes.
Describe your role. What do you do then?
So my role covers quite a few things. As the outreach coordinator in the clinic, my role is to talk to young people about sexual health issues. So if they come in with questions about STDs, they need some guidance in terms of risk-taking behaviors and what the best decisions for them might be. If they need a little bit of guidance in terms of how to actually advocate for themselves and make those good decisions, I provide that service in the clinic, but I also do that outside of the clinic. So I go out to schools and I go out to other community organizations and make myself available outside of the clinic, as well as in our clinic we have a classroom. And our classroom, we will be offering classes on nutrition and classes on STDs and classes on safer sex and classes on decision making and healthy relationships. So I do all of those different things and offer that piece of.
Boy, a lot of what you cover, parents are talking about now. I think about some of the news stories we've seen recently in this city and what's on a lot of minds. And you're covering a lot of that at OneWorld. When you see patients that are 19 and under, 18, like, do they all have to have parents with them, or how does that work at this new clinic?
So we know that parents are busy. We do encourage parents to be involved in their young people's health care, in their children's lives in terms of school and in terms of health as well. It's important for parents to be involved, but sometimes they're really busy and can't necessarily take off of work. So we are, and being so close to South High, we are going to try to offer options for parents to be involved and give permission for their children to seek health care, but also say, I can't come to this visit. And how do we facilitate that communication between us and the parent so that they know what's going on still in their kids' health care, but also we can see them when they need to be seen. If they just need to come over after school, they can come over after school. We can call them and see them. There are some services that young people can seek. We're a Title X clinic. And in the state of Nebraska, there are some services around sexual health that teens do have a right to seek confidentially, and we will offer those services confidentially as well.
All right, you're here to talk about the Teen and Young Adult Health Center. So let's talk about appointments. It's opening today. How do they make appointments for that?
Give us a call. Yeah, that 502-8880. Just give us a call today.
Not complicated.
Stop by. The door's open. We're probably not terribly busy because we just opened the door.
Right. You've
love
been
to
spreading
see
the word for a
anybody.
while now about this
We
clinic.
have.
Yeah.
We knew it was coming.
That's right.
Alyssa, this isn't just about today and the health of the teens who are coming to see you now, but it's when they're adults and when they're older. And it's like in some world, you are preventing bigger problems from happening down the road. So what do you see as if you look at that big picture about community health in Omaha, what do you see as your role in opening a clinic today, but what it means decades from now?
Well, hopefully by opening a teen and young adult health center and really being in that critical moment where a lot of people's lives can go off track because of poor decisions and not having access to the right information, access to the resources they need. You see young people who, let's say young women get pregnant in high school, don't finish, or finish but don't go to college, or finish and go to college but never really have the opportunity to make all of the choices they want to make in their lives. We hope to really be that point of intervention where this young woman's health or young man's health is improved, which improves the health of their children, which improves the health of their children.
Yeah, and it's not just about the Teen and Young Adult Center. I mean, you cover the gamut at OneWorld
Yeah.
Health. You cover all
Like-
kinds of community health issues.
Our eyes have been opened through this series, and you can learn more online. All the details are there at oneworldomaha.org. We'll let you go because you've got plans.
Yeah, I'm
You've
busy.
got things
You've got a
happening.
center
Alyssa.
to open today. Yeah, thanks, Liz. Thanks for coming.
Thank
Thank you for having
Guest of
me.
the morning, Glenn.